Today we are going to study a very important topic of interdepartment subject, which is cancer. Introduction to cancer. Normally, your body forms new cells as you need them, replacing old cells that die. Sometimes this process goes wrong. New cells grow even when you don't need them, and old cells don't die when they should. These extra cells can form a mass called a tumor. These cells vary from a normal cell in size, chromosome number, and have cluster of cells without a boundary. Cancer begins when a single cell mutates, resulting in a breakdown of the normal regulatory controls that keep cell division in check. These mutations can be inherited, caused by errors in DNA replication, or result from exposure to harmful chemicals. A cancerous tumor can spread to other parts of the body and, if left untreated, be fatal. Tumors can be benign or malignant. Benign tumors aren't cancer while malignant ones are. Cells from malignant tumors can invade nearby tissues. They can also break away and spread to other parts of the body. Cancer is not just one disease but many diseases. There are more than 100 different types of cancer. Most cancers are named for where they start. For example, lung cancer starts in the lung, and breast cancer starts in the breast. The spread of cancer from one part of the body to another is called metastasis. Symptoms and treatment depend on the cancer type and how advanced it is. Most treatment plans may include surgery, radiation, and/or chemotherapy. Some may involve hormone therapy, immunotherapy, or other types of biologic therapy, or stem cell transplantation. Types of cancer. Carcinomas. A carcinoma begins in the skin or the tissue that covers the surface of internal organs and glands. Examples of carcinomas include prostate cancer, breast cancer, lung cancer, and colorectal cancer. Sarcomas. A sarcoma begins in the tissues that support and connect the body. A sarcoma can develop in fat, muscles, nerves, tendons, joints, blood vessels, lymph vessels, cartilage, or bone. Sarcomas are typically divided into two major groups, bone sarcomas and soft tissue sarcomas. Leukemias. Leukemia is a cancer of the blood. Leukemia begins when healthy blood cells change and grow uncontrollably. The four main types of leukemia are acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, chronic myeloid leukemia. Lymphomas. Lymphoma is a cancer that begins in the lymphatic system. The lymphatic system is a network of vessels and glands that help fight infection. There are two main types of lymphomas. Hodgkin lymphoma, non-Hodgkin lymphoma. Cause of cancer. Cancer is caused by exogenous and endogenous factors. Exogenous factors include environmental and lifestyle factors. Environmental factors associated with cancer. Tobacco is the most important and most known cause of cancer of the lung. Active tobacco use has been linked with many cancer types: lung, oropharyngeal, bladder, pancreatic, cervix, and kidneys. Nutrition and diet. Intake of fatty, creamy foods with red meat, as well as spicy and very saucy meals have been associated with cancer of the colon. Alcohol has been linked to cancers of the oral cavity, pharynx, larynx, esophagus, and liver. Studies suggest that alcohol appears to act synergistically with smoking. So if an individual loves to drink and to smoke, cancer is likely to develop. Radiation. The 20th and 21st centuries have exposed most children to the rays of television. Radiation by direct sunlight over prolonged drugs. Drug interaction and excessive use of drugs is one probable risk factor for cancer. Diethylstilbestrol, a synthetic estrogen used in the past for the treatment of the threatened abortion, has been associated with vaginal and cervical cancers. An increase in the incidence of liver cancer among young women has been associated with oral contraceptives. Long-term use of estrogen also been linked to breast cancer. Risk factors for a specific type of cancer. Breast cancer. Family history, immediate female relatives. High-fat diet. Obesity after menopause. Early menarche, late menopause. Alcohol consumption. Postmenopausal estrogen and progestin. First child after age 30. Cervical cancer. Multiple sexual partner, having sex at early age, exposure to human papillomavirus, smoking. Skin cancer. Excessive exposure to UV radiation, sun. Fair complexion. Work with coal, tar, pitch, or creosote. Multiple or atypical nevi, males. Stomach cancer. Family history. Diet heavy in smoked, pickled, or salted foods. Testicular cancer, undescended testicles, consumption of hormones by mothers during pregnancy. Prostate cancer, increasing of age, family history, diet high in animal fat. Cancer chemotherapy. Chemotherapy is a kind of treatment that uses drugs to attack cancer cells. It is called a systemic treatment since the drug, entering through the bloodstream, travels throughout the body and kills cancer cells at their sites. The drugs may rarely be intended to have a local effect, but in most cases, the intention is to destroy cancer cells wherever they may exist in the body. Chemotherapeutic drugs are chemically designed to target cells that are dividing and growing rapidly. Once they reach the cancer cells, they act to retard their growth, eventually resulting in their destruction. The chemotherapy is decided on the basis of the type of cancer. Chemotherapy is used to treat early-stage invasive breast cancer to get rid of any cancer cells that may be left behind after surgery and to reduce the risk of the cancer coming back. Advanced stage breast cancer to destroy or damage the cancer cells as much as possible. Side effects of chemotherapy. Most patients experience some degree of side effects, which may include any or all of the following. Nausea and vomiting. This is a common side effect of chemotherapy. It can be controlled with anti-sickness drugs, antiemetics. Fatigue. Chemotherapy affects different people in different ways. They become tired and have to take things more slowly. Hair loss. This is the least harmful side effect, yet can be the hardest to bear. Susceptibility to infections. When the drugs act on cancer cells, they also destroy normal cells including white blood cells, which fight infections. When white blood cells are in short supply, the body's immune system is weakened, making you susceptible to infections. Decrease in blood cell count. During chemotherapy, you may become anemic. Mouth sores and ulcers. Some chemotherapy drugs cause sores and ulcers in the mouth. If you find the video helpful, then please do consider subscribing the channel.